The only main message that I was going to pass from how I kind of deal with patients is, I think number one is, it's kind of more of a philosophy. I think that between all of us, there's an overlap. So we all treat some of the same patients. And I think we each have some patients which we probably treat better than others, as in category of. And I think it's a bit of identifying when to refer on. So any specialty can go into that risk of they come to me and then it's like early intervention, or me or a colleague. They can go to perhaps an osteopath or a physio, keep on going through courses of those. And I think we all see that in clinic practice, and we're all at risk of making those mistakes. But for me, when I see a patient in clinic, as I've already kind of mentioned a lot of it, it's history, examination, those guide me. But it's and that's the other thing I was going to mention, is self-selecting groups for each of us. So patients who come to me have already been through usually a significant amount of, let's call it conservative management, or whatever that therapy modality may be. Or they're patients who actually want to see me. So either way, I think, and then if we're really going into the depth of the psychosocial and whichever, sometimes treating the patient is also kind of going along with where they want things to go as well. But I take the points that you mentioned as well, Elliot. So I think that, yeah, and what I do, I think, in terms of afterwards, I think that's the other key slide, is options, and for the patient to weigh them up. So when I get to a diagnosis, and sometimes there's additional investigations, then it's a matter of weighing up options, and it's either, generally speaking, I give them 3 options: either carrying on conservative management, and conservative management, I put within that a wide umbrella, and then I might guide them to where I think they may benefit in terms of the talks that you heard before, or injection treatment, and sometimes that's for diagnostic purposes, or surgery, and then it's for the patient to think about themselves, their quality of life. They weigh up the pros and cons, and they decide where they want to go. It's a summary of my talk without me showing you your slides, any slides.